We're recording today's webinar, and the closed caption reporting will be available through our website in about 2 weeks. Today's presentation will be followed by a question and answer session, but all phone lines will be muted throughout the webinar. We won't take questions by phone, but we'll take them via the WebEx Q&A or chat feature on the right side of your screen. You may ask your question at any time during the presentation. All you need to do is click on Q&A, select all panelists, type in your question, and then hit send. Again, ask your question at any time during the webinar. During the presentation and following, I'll collate your questions and facilitate the question and answer session with Dr. Pirolli, who I'm pleased to present. Today's presenter, Dr. Peter Pirolli, who's a senior research scientist with the Institute for Human and Machine Cognition. His research focuses on human-computer interaction, information visualization, information foraging theory, sense-making, and social information foraging. I'm very happy to welcome Dr. Pirolli here to present computational cognitive models on mHealth interventions. Peter?
Well, thank you very much. It's great to be here. So a few years ago, I got very interested in this problem of lifestyle change. That is, how can we help people acquire and maintain healthy habits, such as eating better, increasing their physical activity, increased exercise, reducing stress. And one of the reasons I got interested in this, partly for personal reasons, but also because of the broader challenges. It's the case that behavioral and environmental factors account for more deaths than genetics. About 70% of healthcare costs are due to changeable behavior, such as improved diet and fitness and smoking. And I've seen a wide range of estimates, but they're all really, really big, like $500 billion to $1 trillion per year in the U.S. healthcare system alone, never mind globally. And so it also seemed like there was a really big opportunity in the digital space. That is, now we've got pervasive technology everywhere. We were just talking before the meeting here about smart homes and how everything in your house can be controlled and hacked. And so there's this pervasive technology that can interact with you all day long, everywhere. And so this seemed like it was an opportunity for disruptive innovation and the ability to bring evidence-based interventions and theory into behavior change in the real world, in the ecology of everyday life. And so it seemed like there's an opportunity to create interventions that are accessible, that are scalable to a broader population and broader geographic range, that are replicable, so you can do things over and over again with different kinds of people, and sustainable. People are buying these technologies in great numbers, and it seems like everybody has a smart TV in their house, so this seemed like it was a great opportunity. So what I want to do in this talk is, first of all, give a brief general overview of a project called Fittle Plus that's centered around a mobile health platform. But then I want to do more of a deep dive into the computational cognitive models that we're developing for predicting the day-by-day individual behavior that we're seeing in some of these systems. And I'm going to focus in on two of the things that we've done. One is improving self-efficacy, or this perception that people have, this confidence they have in their own abilities, and how we can help people gain more self-efficacy. And another intervention technique that is very simple but seems to work fairly well, which is something called implementation intentions, which are these very small plans that you make for things like going for a walk or going to the gym. And having made these little tiny plans, it seems to have this amazing impact on whether you do them or not. So this Fittle Plus system or project is something that was initially funded through the National Science Foundation Smart and Connected Health Program, which is done in collaboration with NIH. And that first project has just ended recently, and we are now getting some additional funding through the National Institute of Health, in particular the National Institute on Aging, to try to bring this to a more senior population. And again, the main idea behind this platform is to help people develop healthy habits, to meet specific behavioral goals, and to provide interventions that help them do that. So the specific project in the Smart Connected Health program was to build what we call scaffolding interventions to help people build healthy habits using smartphone technologies. And I'll talk more about what some of those interventions are in a second. And then, having done various experiments and deployments, can we start to build a more integrative predictive theory about what is happening to individuals as they're changing their behavior and acquiring these healthy habits? And our ultimate goal, I believe, is to try to now use this theory to develop very individualized models of each person in a way that now supports more artificially intelligent coaching, and to help build systems that could optimize the coaching that people are getting over these systems. So as I said, this system has evolved over time, and we've built various versions of it that have been deployed for various purposes. There was an early version called D-Stress, which was largely built by Artie Conrad, who is a student at the University of California, Santa Cruz, and that was aimed at exercise and meditation to reduce stress reduction. There was another system called Neutral Walking, which was targeted for sedentary folks in the workplace who needed to increase their physical activity and have better eating habits. And there's a more recent version that we just simply call Fittle Plus that has multiple habits that we're trying to support using JITIs, or what are called just-in-time adaptive interventions, and we're still working on that one. Just to give you kind of a close-up of one of the more recent versions of this, this is sort of, there's shadows of this in every one of the systems that we've built. In the center there is kind of the main screen, which displays what your goal is for the day, which is this particular habit called eating slowly. In this particular case, you can do you self-report whether you've done this or not. And if you answer a question, there may be more questions that we ask in a very simple way about this stuff. And we have the ability to hook this up to various devices. So with our elderly population, we are hooking it up to a kind of device called a Misfit, which is like a Fitbit for physical activity. So we can collect data from any kind of sensor that we're interested in. Off to the left there are various analytics that you can display to people about how people are performing, and there's lots of different ways that we could display that. On the second screen there is our chatbot that that can communicate directly with an individual and ask various forms of questions. Then on the right side there, the last two, there's kind of this Facebook-like feed. So in most of our studies, we organize people into small teams, usually 5 to 8 people, who are working on essentially the same goals. And so people can communicate with one another as they're trying to address these things. And then you can do person-to-person chats. That's the rightmost screen there if you want to talk to an individual. In some cases, we put administrators or coaches into these teams so they can talk to those folks. I'm not going to go into too much detail, but one of the more fascinating and least understood components of this is what's going on in the teaming component. So we know from the data, well, first of all, we know that if you're in teams versus not in teams, that has a substantial impact on improvement in achieving your goals. And we also know from the data that there's a pretty big signal for something about good teams versus poor teams. So you can be part of an enthusiastic, socially supportive team and really be accomplishing stuff, or you can be in a essentially silent team. And so all I can say now is that it's really fascinating and we don't understand it. So that's kind of like a real big piece to go after at some point. So this is kind of a notional architecture of the system, or an aspirational version of the system. Some of these components, most of these components have been done, but some, like the AI coaching engine, are really underdeveloped right now. So starting at the top there, one of the things that we do is we go out into the literature and try to find evidence-based interventions that really suggest that they have produced substantial effects, and try to figure out how to map that into a mobile health deployment. And this is what we call these adaptive scaffolding interventions. And then on the left top, we have to have behavior change programs. We need to have exercises and nutrition habits, and so we go to subject matter experts, consultants, and personal trainers to help tell us what those things may be, to develop all the text content for psychoeducational material. We've got videos of the exercises using appropriate models for the populations that we're dealing with, all the tips and all the reminders. All that stuff has to be done in consultation with people who know what they're doing. And then what this system is doing is on a daily basis is, it does some assessment of where people are, gives people their daily goals. If it's part of the experiment, we give them these scaffolding interventions, which are these additional things to help them do these daily goals. And of course, we collect lots of data from both the individuals as well as what's going on with the teams. Some of this is used to build various user models, and what eventually we want to get to is a coaching engine that has these optimized intervention policies, but we're not quite there yet. So the behavior change interventions that we're basically looking at, to a large extent, come from this behavior change taxonomy. So there's a huge literature on behavior change out there, and there's a group led by Susan Mickey who's done this Herculean task of going through the literature and trying to categorize and organize what all that literature is. And it's an amazing body of work. It's been published in books and papers, and so far as last I looked, there are 93 different behavior change techniques, 83 different theories, 26 mechanisms of action, and over 1,700 theoretical constructs. Now, we did our best to try to select what we thought were the best of breed in these things, and most recently there was a meta-analysis of this taxonomy where they actually estimated the effect sizes of these different behavior change techniques, and we found that the ones that we had selected were indeed sort of in the top 8 or so of the ones that they found. So we think that we picked the right ones. This is kind of the set of things that, sorry, I'm just waiting for this to catch up here. This is the set of things that we've tested in various versions of this system. I'm not going to go through all of them, but essentially there's one set of things that do what we call guided mastery. That is, we try to find things that are easy for you to do, that you feel confident that you can do, and then sort of slowly increase what the difficulty of those goals are until you achieve more difficult things. We do this team social support that I mentioned. We've got this other technique called self-affirmation, which is where you get people to think about what they value, and it has this amazing effect on people's behavior change. And then this notion of implementation intentions, which is where people actually plan out what they're going to do. And these have all been tested in various versions of this system and various experiments, and we've been able to get effects of each one of these things. So in this particular talk, I'm going to talk about the computational models that we've developed for the data that we got in 2 of the studies of these particular interventions. And the other things are things that we'd like to get to if we get the chance. Now, one question is, why model? So why do we want to build computational models of all of these data? And so so some of the reasons are that, first of all, just developing these predictive computational mechanistic models gives you a deeper understanding and insight into what you think is going on as people are changing their behaviors. And if you have that model, those models and those theories, that might be the basis for new kinds of tools and new kinds of methods. You might be able to predict the impact of new forms of technology and different interventions and new kinds of interaction techniques. In our specific case, one of the things that we would like to do is to be able to predict the effects of very precise targeted interventions for individual people. So, can you have kind of a precision behavioral medicine that comes out of such theory? And if you could you then build some artificial intelligence coaching machinery to do that kind of stuff? Now, in addition, one of the reasons why I'm interested in modeling is I have this belief that all this behavior change theory that we see out there needs some degree of harmonization. So the fact that you've got 83 different theories is kind of ripe for something to try to organize it into a more unified or integrated kind of theory. So that's one major reason why I think it's really important to start to try to develop not only predictive models, but models that have this property of harmonizing the domain of behavior change. Okay, so a large part of what this Fittle platform is doing is really centered on trying to get people to acquire healthy habits. And there is kind of a consensus view on habit formation, and that is if you've got a bunch of bad habits, the way that you get good habits is only by overriding the old ones, that there's sort of no way to excise the old habits except by overriding them with new ones. And typically, to learn new habits, it's a long process, and it typically begins with a very goal-driven, effortful, goal-striving phase, where you have to really pay attention and work hard to try to execute the behaviors that you're trying to do. And I don't know that these exact timelines here are correct, but on the order of weeks to months to years to develop new healthy habits seems to be kind of the consensus of how long it takes to do these things. And then eventually, if these habits do form, then they operate in a much less effortful way, sort of almost without thought. And then the trick is, how do you maintain them? Because they can be disrupted by changes in the environment or changes in your family situation or workplace or whatever. And so there is kind of, how do you keep things going in the right way? And the neuroscience underlying this is from a recent Scientific American article. The recent neuroscience does in fact suggest that there are kind of two subsystems that are involved in habit formation that underlie these two processes. So the red loops there are associated with this goal-striving phase, and there appears to be this loop of activity that goes through the prefrontal cortex, and that's where goals are, and that's where memories are, and that's where all the cognitive effort seems to take place. And as these behaviors get repeated over and over and over again, then there's another circuit that seems to emerge, which is this yellow circuit here, which is pretty much directly, through the sensory motor cortex and through the action cortex with no prefrontal goal involvement at all. And so that is, in fact, sort of at the core of the modeling efforts that I'm going to discuss here in a second. So the first model that I want to talk about is a computational cognitive model of self-efficacy and achievement of daily goals in a particular mobile health deployment that we did. And our goal here was to take a fairly well-known theory of self-efficacy that is got thousands of articles in the literature about it, and take this kind of macro theory of self-efficacy and behavior change and map that down into a finer-grained computational simulation that's based on this neurocognitive theory called ACT-R. And ACT-R is it's primarily associated with John Anderson at Carnegie Mellon University, and there's a whole community now that's emerged over the decades that does a lot of work with this particular theory and architecture. And it's basically a theory of the structure of the brain in the functioning of the mind. There are lots of experimental psychologists who use this to understand memory and learning and language and all sorts of things. And there's also been a lot of work mapping how this theory is actually implemented in the brain using neuroimaging techniques like fMRI and EEG. And the theory is actually delivered as a software simulation environment. So you can build simulations of how people think for different kinds of tasks. And it is essentially a model of how the various brain modules for goals and memories and perception operate together dynamically over time in a coherent way to produce behavior. And I'm not going to go into any of the details of all the dynamics, and in fact, I just realized that this isn't even all of the equations. But there are a whole set of equations that determine how this system works, that have to do with how memories are learned and what's the probability of remembering stuff. What is the, what effects will reward have on the operation of a skill or a habit. And so all of these things are operating all the time dynamically in these situations, and they determine how the system actually works. And this is just another way of presenting this in a slightly easier to perceive way. And the way that this thing works is, as I said, there are these different modules, for example, for goals or declarative memory, which is what we typically think of where experiences and knowledge are stored, or what we call this imaginal module where plans live. And at the center of all of this is a particular module called the procedural module, which is where habits and cognitive skills, and we represent these things as rules. This is where they operate. And what they basically do is determine the flow of information among all of these modules. So asking memories to be recalled, trying to implement a goal, it all goes through this central process in a very continuous way. Now, I only use a subset of these modules in the two models that I'm going to be presenting because I'm not modeling anything about hearing and seeing and things like that. I'm going to focus in on goals and plans and memories and this procedural operation of mental habits. So in this particular study of self-efficacy, this is this system developed by Artie Conrad called de-stress, and the objective here was to, this was mainly for people in the workplace, help them with exercises and meditation to reduce stress. And I should just say that the study that he did basically showed that in fact was what the system was doing. So this was a 4-week program. We had 65 people engaged in the experiment. The mobile application had a pool of exercises for upper body, lower body, and circuit training. We had meditation exercises, and you would get exercises one day, meditation on alternate days. There were instructions and images for everything that you had to do, and people were self-reporting on whether they did these things or not. Now, I should mention that there's a separate experiment that we've done where we show that these self-reports are actually pretty responsible and accurate. After all, we're paying people. So we believe the data that are coming back about whether people achieve these goals or not. And in this study, we were primarily interested in this personalized adaptive scheduling, which is represented by the squiggly line in the middle. So there was one group of people whose exercises were assigned to them based on their past performance. So if they were not going to the gym and not doing their exercises at home, then we would modulate what their goals were for the next day. And then we had two other groups that had these fixed schedules where the difficulty of the exercises ramped up. And in the difficult fixed schedule condition, they ramped up pretty seriously. And in the easy condition, they ramped up slowly. And part of the thing that we were looking for was whether this adaptive scheduling had a bigger impact and whether it was in fact building up something like self-efficacy, that people were building up confidence in their ability to do these things. We went to subject matter experts and just had them go through these exercises, and these experts actually selected a lot of these exercises, and have them go through and just rate a priori. What are the difficulties of these things on a 7-point scale? And so this is how we seeded the algorithm. Post hoc, we went in and analyzed the data and used a particular item response theory model called a rash measurement model, which basically allowed us to estimate, to essentially pull out the ability levels of individuals and the difficulty levels of these exercises so that we would get some validation of the difficulty of those exercises. And so post hoc, the main thing to look at is on the right-hand side, we have the expert ratings of the difficulty levels and then the estimated difficulty levels that came out post hoc, and there was a very high correlation. So we validated the manipulation we were doing. So here's sort of some of the basic results. On the left here is, we've taken the data that we've collected, and then for every individual in every condition on every day, tried to pool together what was the difficulty level that those people were getting at that point in time. And remember, a lot of these people are getting individualized subsets. And so one thing you can see is that, sure, the people in that difficult condition were indeed getting assigned more difficult exercises, the one in the easy condition getting easier exercises, and our adjustable de-stress condition is somewhere in between. Now on the right is how successful people were in doing the goals that we were assigning them. And again, over this 28-day period, what you see is that in that de-stress condition, the success rates are much higher than those in the easy condition or the difficult condition, even though the exercises that they're doing are more difficult than the ones in the easy condition. So it seems like there's something that has been built up through this personalization and by giving people things that are kind of appropriate for their level of achievement. And our belief is that what we're doing is we're building up self-efficacy through this guided mastery process. So here's the intuition behind the computational model that we developed. What we do is we assume that people have these goals that have been assigned to them, and they basically say, okay, I've got this goal to do these activities, and I perceive them to have a certain level of difficulty. So I'm going to think, well, what have I ever done in my experiences that are stored away in memory that are similar to this particular goal? And then is there, how difficult were those things that are like the thing that I'm trying to do? And we assume in ACT-R, there's a process that sort of calls into memory and can blend together all those experiences and come out with a perceived judgment of the difficulty of those things. And so now that you sort of say, well, here's what I've done in the past, that gives you a judgment about what your level of ability is now. And now you're doing this kind of comparison where you say, well, here's what I think I can do, here's the difficulty of the thing that I'm trying to do, and here's the amount of additional effort that I want to put into it. I can make a prediction about whether I'm going to succeed or not. And that judgment of success is basically this judgment of self-efficacy. And if your self-efficacy is high, then we're basically going to predict that you're going to do it. And if you do it, that now becomes a new experience. And that experience now goes into memory. And so the next time you go through this whole process, that experience is biasing you to, if it was a positive experience, it biases you to believe that you're more able to do these things in the future. So the more of these positive experiences that you have, and if we can guide you to always have these positive experiences, your memory of that builds up, and it biases your judgments of self-efficacy. Okay, so that is in fact what's happening inside of the model as we're doing all this computation. So one level to look at is to say, well, if indeed these positive experiences have an impact that's primarily a memory impact, what would we predict? Well, you would predict that it would have this impulse-like property to it, that when you have a positive experience, it boosts your self-efficacy, but we forget things. And so as time goes by, that those positive impulses will decay with time. And if you go and look at the data, you would expect to see what are called frequency effects. That is, if you've had a positive experience for a long period of time, day after day over many years, then you should have confidence that you can do it tomorrow or today. There would be this recency or lag effect. If it's been a long time since you've ever had an experience, it would have a decreasing effect on your confidence or your self-efficacy. And sort of the size, or what I might call a stretch effect, of the thing that you achieved. So if you really did something phenomenal, it would boost your ability even more. So if I surfed a 20-foot wave, which is pretty big, you might be confident you're more likely to do it tomorrow. Okay. And if you go look at the data, at least at this macro level, that's what you see. Just waiting for it to refresh here. So so if we look at that de-stress data and plot it in these ways, where we say, okay, what's the likelihood of succeeding on your exercise goals today, given the frequency that you did those exercises in the past, we get a positive relationship. If we look at how long it's been since your last positive experience, the success rates go down. And if we look at the difficulty of the exercises that you were doing in the past, then as that increases, it has a more likely impact on your degree of success. So now what we do with the simulation model is we go through the traces of every individual, and we go through that routine that I just said. So for every positive experience, that goes into that individual's memory simulation. And what's plotted here on the left is we trace through every single person, every day, every exercise, and predict the likelihood of adhering to their behavioral goals. And what we have plotted here is the predicted success versus the observed success, pooled by day and by condition for all the individuals that we have the data on. And you can see that there's this very high correlation. And if we plot it in the way that I displayed the data earlier, so this is just the same data I showed you before. So this is over the 28-day period, and this is the observed success rates, and the top line there is the adjustable algorithm. This is what the model is predicting for the people in those particular conditions, and you can see it's not perfect, but it's sort of all generally in the right shapes and in the right direction. Now, I want to make sure that people know that there are other models out there, and so this is one that Dr. Riley was part of in constructing, which is a very different kind of model. So it's not a computational cognitive model, but what's called a control system theory model. And it works in a very, very different way. And so one of the things that might be interesting to do is to see how that model compares to the model that we've developed, although I will be making a set of claims about our modeling technique at the end about why it's superior. Okay, so I want to move on to the next computational model, which is about a different kind of intervention called implementation intentions. And implementation intentions are these simple mental representations of very simple plans. And the idea is that you're trying to translate your intentions to do something into actual behavior. And this has been studied probably since the 90s in great detail. And the intervention is fairly simple. You get people to fill in these templates where you say, if I'm in this situation, then I will do this action. And so if your goal was to walk more, you want to be very specific. You want to say, if it's 5:30 p.m. on a weekday, then I will go out for a 40-minute walk. And if you can specify when you're going to do it, where you're going to do it, with whom you're going to do it, the more concrete you are, the better these things seem to work. And one of the interesting things about this technique is that it has a medium to large effect size in all the studies that have been meta-analyzed. And it's superior to interventions where the goal is to try to increase motivation or commitment to just the goals. So if you focus in on the translation of goals, this seems to have an impact. And it's not entirely clear how these things work, but this is sort of the best thinking about it, that somehow when you form these declarative plans that go into memory, that somehow the mental perceptions and representations of the situation in which you want to do this thing somehow become more accessible. So if you said, I'm going to do something at 5:30, somehow you just sort of awaken to the fact that it's 5:30, and you go, oh my goodness, I'm supposed to go to do this thing. So that's one piece of the puzzle, that somehow it makes the context more triggering. The other piece is that it seems to produce an associative link between the situation and these actions that you said you were going to do. And it creates a heightened readiness to do those things, and then it takes less effort to do these things. And so there's various more detailed experiments where if you prime these implementation intentions, meaning that you somehow make them more active in memory, it improves the effect of those implementation intentions. And so that, again, suggests that there's an underlying memory mechanism here, which is what ACT-R does very well. And so things like mobile health reminders ought to be able to improve, strengthen the memory of those implementation intentions, and then actually have a bigger impact on behavior change. And so that's what we explored in this particular experiment. So at a general level, here's what we think is going on, and this is how it's actually implemented in the simulation system. So we have these things that we call intentions, which are a form of prospective memory, meaning that it's a representation that you've stuck in memory where you say, when it's time, I'm going to do this thing. And you can, at any point in time, you could remember what that thing is, and when the time comes, hopefully you'll do it. And the implementation intentions are these very, plan-like representations that are also stored in memory about the specific behaviors that you're going to do. Now, we can use things like reminders, like, pamphlets to, remind you about sorting and recycling your trash, SMS messages, an X on your calendar. And every time you encounter one of those things, it somehow boosts your memory of that thing, and hopefully that increases your memory so that those implementation intentions will have the right impact in the right context. Now, the theory, ACT-R theory, also has this process that we call compilation. And compilation is this idea that every time you do one of these more complicated sequence of steps that involves lots of memory retrievals and lots of goals, this whole goal-striving process, that gets compiled into a simpler rule that will just execute and carry out that action without all of that cognition involved. And this is sort of a well-studied process from many, many experiments. And then there is this kind of rewarding that happens, this utility learning. That is, if you succeed in doing these things, those habits get rewarded and they slowly overtake the old habits. So that's sort of all at the core of this simulation. So just to walk you through it in a slightly different way. So these are just the modules that I'm going to walk through. And just to have a slightly different example, suppose that you're trying to learn to sort your trash into recycling. And so you've got this old habit, which is that you just take out the trash and don't sort it. And there's just this rule that sort of says when it's trash time, you go through the behaviors of doing this thing. Now, simultaneously, as you're doing this, your memory system may be activating the intentions that you had for taking out the trash. And now you've sort of put a new one in there that is, I've got this new intention for sorting and recycling my trash. And so that's now in memory. And now what happens is if I have reminders that are reminding you of these specific things, it might actually boost that intention up to be high enough to become a new goal. And then that, in addition, having retrieved that goal, you go into memory and say, well, how am I going to do this? Oh, yes, I made this little plan. And so these little plans also get retrieved from memory. And then, you have generic ways of interpreting these instructions for how to go about doing this, and it takes a lot of effort, but you go through it all and you do it, and then every time you do it, there is this compilation of new rules that will overtake the old ones. And so eventually you will get a new rule that doesn't involve any memory and any goals, that is triggered by the context and just executes those particular behaviors. So in essence, there is this dual system a goal-striving system that's can be affected by these manipulations of implementation intentions, and that every time you do these experiences, this habit formation and habit execution has the impact of building up these habits. And so what I have on the right here is sort of a diagram of the different pathways that you can get to actually executing the behavior. And in our experiment, what we're manipulating is the fact that we can deliver reminders at different times to boost the activation of these intentions. And every time you actually succeed in doing these experiences, it also helps you remember these things in the future. But every time you do these experiences, you're also building or rewarding new habits. So you're slowly building up these new habits, which will eventually take over, hopefully, to carry out these behaviors. So in this experiment, it has a fairly complicated nested design, but this is sort of the essence of it. We had 64 people in this experiment and delivered over a mobile health system over 28 days. And they could choose what habits they wanted to work on. So eating more slowly was one. This is actually a very difficult habit. Walking more, eating more vegetables were some of the other ones. And people were asked to create an implementation intention for the thing that they were working on. And one of the things that we were manipulating was the actual delivery of the reminders for the specific implementation intentions that they had achieved. And there's a theoretical reason for choosing this particular pattern, but basically, for some people, we delivered the reminders kind of at a low frequency, so they got 7 over the course of 28 days. Other people got it at a high frequency, so they got it 14 times over a 28-day period. And then we manipulated what we call the distribution or massing of these things. So in some cases, it was kind of uniform over that period. In other cases, we kind of clustered the reminders together. And a priori from the theory, we believe that this is sort of what's happening to the memory strengths of the implementation intentions here. That every time you get a reminder, it boosts up the strength, and then as time goes by, you're forgetting that stuff. And for each one of these conditions, we can go to the theory a priori and make a prediction about what the behavior change likelihoods or probabilities of success should be in each of the conditions in a particular order here. So the high frequency distributed should be higher than the high frequency masked, which should be higher than the low frequency masked, which should be higher again than the low frequency distributed. So we're predicting a very specific interaction of these two factors as well as a very specific ordering. And this is, in fact, what we got from the experiment. So it's a very precise prediction that we got. Now, perhaps more importantly, what we did, again, was for every individual, go through and trace their particular history of succeeding at their habits given the particular thing that they have gone through. So, for example, every positive experience is having an impact on that particular individual in a slightly different way than a different individual. Not all of the reminders were actually acknowledged, right? So we sent a reminder to a person and they had to say, I got it. And that turns out to be a significant difference because if you don't attend to it, you don't get the reminding effect. So people are getting different patterns of reminders and different patterns of experiences. And what's plotted here is the success rates at achieving their behavioral goals over the span of the 28 days, plotted in different ways. So, and the dots there are the observed data pooled together, and the lines are the pooled predictions for those same people. And so what we see is that the success rates go up with the frequency with which they've achieved their goals. It declines with how long it's been since the last time they achieved the last goal. It improves with the frequency with which they've gotten reminders in the past, and it declines with the recency. And we can see that we're getting pretty good predictions. Again, not exactly precise, and in some of the ones, like the lower right one, we can see that there's a linear trend, and maybe we're predicting a curvilinear trend. But again, we're sort of getting pretty good predictions for all of these guys. So, okay. So anyways, those are two models of fairly lengthy interventions with lots of individual variability, and these computational models seem to be doing reasonably well. So what I want to do to wrap up is go a little bit bigger picture here and make a set of claims or theses about why I think this particular approach of using these cognitive architectures is a good one to do. And these are not my theses, but I've borrowed them from Alan Newell and John Anderson. So one is this property of integration, that the simulation models seem to provide more of a unified account of how the mind is functioning together to produce coherent behavior, and providing a way to get a start on the unification of these vast number of theories and constructs. And so if you look at what's incorporated or implemented in the models that I've presented, there's a little bit of goal-setting theory, a little bit of self-efficacy theory, attributional theory of performance, and the theory of habit formation, sort of all working in conjunction in these simulations. Then another property is what we call decomposition, that you take this stuff that's happening over days and weeks, and maybe extending out to years, and decomposing it down into the events that are happening at a much smaller time scale within days, and saying, well, how are those little things building up to the big things? And the hypothesis is that these particular architectures can bridge those events from the small time scale to the big time scale to make those predictions. And now you say, well, how is that relevant? And the thesis is that if you could get these longer-term health outcomes predicted by this kind of mechanistic theory, it would be more useful for developing these new kinds of behavior change systems in the future. And that's it. Thank you.
Terrific. Thank you, Dr. Pirolli. Let's begin the question and answer session. If you're online, please send your comment by clicking on Q&A and select Ask All Participants, type in your question and send. While we're bringing that up, I'll turn to my colleagues in the room and see if there are any questions for Peter.
I can ask a question. This is Liz Jackson.
Thank you.
So this idea that you're essentially, if I'm getting it right, hoping in the model that you're priming people's memory, and presumably when they begin something new, maybe they don't have as many memories yet of it, or they're,
right.
And so the idea is you're hopefully priming and building memory over time.
Right.
But I wondered, this idea of the reminders and all that also, and the intention, there's a sort of construct overlap that I'm struggling with here. Mm-hmm. How much is in people's memory and your intentions to do things, and how much is intention overlapping as a construct? Do you know what I'm saying here?
You're talking about like the intention to do something, yes, becoming stronger also?
Right, exactly. I don't know if that makes sense.
Yeah, it does. And in fact, I guess I should put this in the slides, but if you look inside the model, that is also happening. Okay. Right. So that every time you have one of these successful behaviors, it is also sort of improving your intentional levels.
Right. And I was thinking how it could work in reverse too, is if you do the thing and it doesn't really go so well, or you hate it, or you fail at it because it was too difficult, it does go into the memory pile, but it also impacts, right, potentially negatively your intention to do it next time.
Right. Yeah, no, exactly. And so that's one reason why with these adjustable things we're trying to avoid that. But I mean, another thing that you might do, I think, in that case is then go back and prime the positive experiences, right? Even from your own past. So if you had a conversation and said, well, what is something that you're extremely proud of in the past that you thought, well, at least I did that or whatever. And so there's probably lots of different ways that one could get at boosting up those positive experiences that then have an impact. Now, I didn't talk about the self-affirmation intervention, which is again, kind of a very simple thing that seems to work really well. And that intervention largely involves getting you to think about things that you value. And somehow, by getting you to get this positive evaluation, it improves your future projection of what you're going to be able to do. And that's not from our research, that's sort of from a lot of other research, and I think that even includes some fMRI stuff, and they can sort of show that, you know, this concept of self is being activated and this kind of concept of value is being activated, and then when you think about this thing that you're about to do, it becomes more likely to be performed. And so, you know, if we had richer ways of interacting to get to those sorts of things, I think that would be a very fruitful thing to do.
Yeah, and I assume that you're modeling this is, you're looking at the individuals, but the ultimate, or one of the goals, is eventually to think about this in the social context, because as you pointed out, you could be in a positive, affirming social group where these interactions are going linearly upward, or it could spiral downward if the group is negative. Or it could just be flat. But
so what we found from the content analysis that we did of at least one of the studies where we had teams involved, we had identified these things to be good ones and these things to be ones that aren't so good, that spiral was exactly what seemed to be going on. So so people were much more social, attending to what other people had done and rewarding them for doing those things. And I'm sure that if we had more data and we could dive into it, there'd be a lot of that process. Now the question is, what's the lever that you have to make that discussion be positive? And I know there's lots of work in that area, but it seems like it's a tricky thing to engineer.
Mm-hmm. And it's easy for it to go wrong.
Yes. Right.
Peter, I might have misunderstood one of your later graphs on the messages that required an acknowledgement.
Yep.
And it seemed that people did more poorly on healthy behaviors if indeed they were required to acknowledge the reminders?
No. So, so there's two separate things. So all the people who are getting reminders do have to acknowledge whether they got it or not.
Okay.
Okay. And what's plotted here is not the frequency with which we delivered you the reminder, but how often did you actually attend to it enough to dismiss it.
Okay.
And if we separate the data out for sending it versus acknowledging it, it's clear it's the acknowledgement that you've at least attended to this reminder. Yeah. Yeah. And what's plotted here is that over the course of time, if you've gotten a lot of these reminders in the past, you're likely to do stuff in the future. And if it's been a while since the last one, that your adherence is going down. So that's what that recency of acknowledgement means.
I'm sorry.
Yeah. No, so it's basically how much have you forgotten since the last reminder.
And then I assume you're probably doing experiments to see if there's an annoyance factor. What's too much? Because obviously it's linear, more is better, but at some point.
Right.
The dosing.
So that is a really great question. I'm trying to remember. I did some analysis that I remember reporting in a paper, and I think it was for this one. We didn't see any annoyance, but even in this experiment, we're delivering no more than once every 2 days. Okay. Right? So that's not particularly annoying. You can imagine if you're, if you're getting notifications every 10 minutes, you're going to get annoyed. And I think that's something that hasn't been incorporated into any of our studies yet. It's not just the reminders, but all of the interventions. So why wouldn't you just throw every intervention in the world at someone to help change their behavior? Well, at some point it becomes too much and you just ignore it. And so there's got to be some cost factor that goes into this too.
And it would strike me that it would depend on what kind of behavior that you're trying to change. So if it's exercise, you only need to exercise maybe once a day or whatever. But if it's trying to quit smoking, you have to deal with that addiction and replacing that bad behavior with a good one
all the time.
Continuously.
Right.
And so the kind of reminders and the kind of intervention you're going to need is totally different.
Right. And there's also this response that people have where they, if they feel that the message is somewhat threatening, like, you keep saying, look, you got to quit smoking. You got to quit smoking. And you're just like, I know that. I just don't want to hear it anymore, right? So getting into these issues of the underlying psychology, I think.
And the fact that your addiction symptoms could be causing you to be irritable, like all these other things.
Right.
That aren't going to happen if you're doing an exercise intervention.
Yeah, right. So, I mean, and even if you go to the literature just on, in the human-computer interaction literature and look at, studies of text messaging and reminders, there's really not a very good theory or models about how much is too much and when is the right time to do it and all the rest of that. So there's not a lot to go by on this stuff. So that's why it's more of an opportunity. Another one.
Absolutely. That's really neat. Mm-hmm.
Okay, great.
Okay.
What a great, thank you for your presentation, Peter, and on computational cognitive models of mHealth intervention and the great conversation we had in the room. Thanks to the many people who joined us online today. If you have colleagues who were unable to join us, please remind them that a recording of today's webinar will be available in approximately 2 weeks on the OBSSR website. It's about the time it takes for us to close caption and then make that available. We are taking some time off for the holidays, so this is the last webinar in our 2018 OBSSR Directors Webinar Series, and we've made some changes for the 2019 series. We'll have approximately 3 to 4 webinars, and I can tell you to mark your calendars now for Tuesday, March 19th, 2019, when our guest presenter will be Dr. Pamela Hurd, professor at the University of Wisconsin School of Medicine and Public Health. Her talk is Personality Predicts Mortality Risk, an integrative data analysis of 15 international longitudinal studies. Registration for Dr. Hurd's March talk will be provided soon in our website and through our OBSSR Connector newsletter through email. So be sure you're signed up to receive our email updates about all upcoming OBSSR events and other news. The link to sign up to receive our updates is available on our website at obssr.od.nih.gov. This concludes today's webinar. Thank you again to Dr. Pirolli and to all of you. We look forward to your participation next year. Thanks for attending. We wish you happy holidays in December and a healthy, prosperous, and science forwarding 2019. Goodbye.
Thank you very much.
All right.